Well, look, we've got an opportunity now, before we finish, to get some varied comments. My apologies to everyone for the brevity required, but let's have some reflections on what are we going to take away in terms of valuable ideas, both from Princess Alexandra Hospital in Brisbane and also our earlier look at the Christie Proton Therapy Centre in the United Kingdom. Let me come first, if I may, to Thomas Masullo from Woods Bagot and also Rosina Di Maria from Woods Bagot in the architectural team working on the inside of the future Australian Bragg Centre for Proton Therapy and Research. Thomas, what are you thinking about? What are the strengths there that you'd say, yeah, that's what we were thinking of, or something you'd like to reaffirm, or whatever?
I found that session really, really interesting, because to me, the thing that was really resonating was this whole idea about demystifying this process, this black art, this black magic that happens behind this curtain. And I found that to be something that was not only something that we had to address as designers, but also an opportunity to create a positive experience. So moving from this idea of a patient-centred care to something that was a very tailored experience for the individuals, not only the patients, but also their families and their carers. And I think we heard some of those examples in PA, right, from My Health, My Way, in terms of how we might do that, embedding wellness into what we do in every single way, and the education programs that we just heard about as well. So I think Rosina spoke a little bit about that particularly, and I think having a number of those touch points along the way, and the journey starts outside of the facility, and I think that's really, really key, because we keep focusing on what happens in the facility.
I guess I'm interested, and I'll just stay with you if I may, Thomas, for a moment, and then I'll come to Rosina, on particularly the design features you're thinking about, because I feel so far we've heard a lot about nature. I can't remember the amazing word that Rosina uses, but she'll tell me it again in a minute.
Yes.
Say it again.
Biophilia.
Biophilia. I love to learn a new word. But, you know, they're talking about bringing nature in, they're talking light. Yes. I think in the paediatric context we've got a lot of animal themes. You know, what are you thinking of in specifics? Also this issue of whether to decorate bunkers, because I've seen bunkers. If you Google, by the way, guys, go to Google Images and Google radiation therapy bunkers or proton therapy bunkers, you will see some that don't look clinical at all.
Yeah. I think one of the key design features that we have created is we've separated that front of house from what I call the back of house treatment areas, and they are on different levels. So when you present it to the building, it's a very public entry. There's a lot of light and double height spaces that one enters into. And when you enter into the treatment reception space, as we call it, it's quite a relaxed environment with a number of different settings in there. And again, talking about all the things that we've heard today, there's connection to the outside as well, directly off that space. So again, there's this direct connection to respite spaces that are external to the building. And then there's some very discrete entries down into the treatment area. And then once we're in the treatment area, we start the journey again, and we start personalising that process again. So now I'm in the treatment area, now I've got a reception counter, there's a different waiting experience, and there's a different way that we now proceed through the space into the bunkers. So I think there's a series of touch points all along the way that we've created and co-creating at the moment.
Thank you so much. And Rosina, a quick comment from you, the key message you want to give those passionately listening and wondering what you're going to do with the Australian Bragg Centre.
It's a big question. What we're going to do is create an integrated environment. I think there's a lot of examples where nature images are attached to walls and kind of still presented, I think, in a healthcare way. We're bringing our knowledge and working with the lifestyle sector, such as when we do work for Qantas clubs, into this kind of thinking so that people have a total integrated design response to an experience, not a healthcare environment with a few touches of that.
If I could just burst in, because I've got so little time with you, but I'm lucky enough to have spent a lot of time in Qantas clubs and less lucky to have spent a lot of time in a waiting room of outside radiation, 30 days straight, when I was full of fear. And I suppose what I'm hoping we've managed to bring through our allied health colleagues, particularly in that session from Princess Alexandra, is the immense psychological trauma that we're facing in anticipation. And I don't think it's an easy gig as a designer to help us settle down and stay as calm as possible. That's just a comment, really.
It is, but it's a privilege. And for us, we take it very seriously that we can bring all of our global thinking and how really successful spaces work for human experience into this. So we're bringing all of our, I design hotels as well as Qantas clubs as well as healthcare environments, because if you remove the barrier of the tag being a health environment and you actually design a space for human need, you can actually soar, and that's what we're hoping for.
And I was thinking a lot of people are scared of flying too, so there is a link. There are I mean that quite seriously. True. People do have fear of flying. If I could come to Associate Professor Peter Gorayski, radiation oncologist, Royal Adelaide Hospital. It's cruel, Peter, but just 2 or 3 quick comments. What should we take away from Princess Alexandra?
PA Hospital are some of Australia's leading research groups with regards to patient-reported outcome measure capture using mobile technology. So I think the work that Dr. Brown is doing is fascinating. Why that's relevant for the Bragg Centre is because it will be, at least initially, the national proton therapy service. So we will be treating patients from all Australian states and territories. So patients will be coming far and wide. And I'm very fascinated to see that these PROM captures may actually translate into fewer clinic visits into the future. And that's important for us because we'll be treating centrally, but these patients, after they have their proton therapy, will go back to their home states. And so this will be a unique way to track them alongside their primary healthcare providers and their specialists back home. And then the other thing just quickly is this concept of wellness. And also going back to the Christie, I love this idea of a bespoke shuttle bus and also patient accommodation located centrally. And that's important here because Australia, the Bragg Centre is going to be literally on North Terrace in Adelaide, which is in the CBD. And luckily we have lots of facilities around for young children and young adults, including the zoo, the Adelaide Oval, commercial districts, parks and playgrounds readily available. And then the Children's Hospital, where many of these patients will have their chemotherapy managed, is only a few hundred metres away. And so is the Royal Adelaide Hospital, the main tertiary centre for adult care in this city.
I just want to say that Jodie Nixon, the occupational therapist from Princess Alexandra, was very keen for me to emphasise that exercise is a big part of their program too. I'll just make a comment. I don't have time for a response, Peter, but in the 7 years since I was treated, and I've been visiting multiple bunkers as some sort of mad, obsessive patient advocate, it's a way of dealing with trauma, at least it's constructive, I've noticed that it's really hard to keep the space you set aside for patients. It gets eaten by offices and consulting rooms. So it's not just making the space for patients, it's keeping the space as time goes on. But Dr. Bena Brown, now with the Menzies School of Health Research, speech pathologist by background, and we saw you on the video. 2 key comments. What's the message to our designers who are listening to you now, working on the new Bragg Centre?
I think for me, what I've taken away from this session, which has been wonderful, thank you so much for coordinating, Julie, and thanks to all the great speakers, is 2 things. 1, establishing, maintaining, and really committing to developing relationships with people coming in for treatment and their families. And 2, bringing the outside in. And creating a welcoming, comfortable, safe space. So I think if you get those 2 elements right, the people element and the design element, then you've probably got a winning service and a winning model of care.
And we've got to help. I love Jodie Nixon mentioning kindness, but we've also got to get those dogs into the public waiting rooms because I think it's a staffing issue. It's as Phyllis Bhutto, who I'll come to now if I may, Professor Phyllis Bhutto, School of Psychology, University of Sydney, You mentioned earlier the importance of staffing in order to allow radiation therapists to notice we're upset and get us some kindness. One or two last comments from you before we head off to Rare Cancers Australia.
Well, I'd really reinforce the importance of hearing about the patient experience, and one way of doing that is through patient-reported outcomes, because people often feel like they are so grateful for their care, very aware that health professionals don't have time, so they don't raise these issues. And so the patient-reported outcomes allows them an avenue to do that. But also, and we always used to train our young medical staff to do this, to just say, for people to say, is there anything concerning you today? And is there anything else concerning you today? And by that time, people generally are able to raise issues. So the importance of that human element is just so critical.
And such a good, simple question. The only thing I'd add is maintain eye contact while you say it. Because sometimes as patients, these people who we grow to love, you do love people because you want them to be good. You want to believe they're going to help you survive. It's very hard to interrupt their busy day with whatever's upsetting you. Now, I know some clinicians watching this will say some people have no trouble interrupting me, but some of us do. Look, I'd like to also just acknowledge the work of Deb Page from the Australian Bragg Centre, who's been absolutely fundamental, along with Daniel Taylor, Inside IT, in creating these webinars. There will be 3 next year. Make sure you register on YouTube. You go to YouTube and you put in SAHMRI, South Australian Health and Medical Research Institute. That's the acronym. Put in SAHMRI and Bragg and it will come up, and we'll send you links. But before we finish our second our webinar consultation for 2020, I want to welcome from Dr. Amanda Ruth from Rare Cancers Australia and the National Oncology Alliance. Amanda has a PhD in immunology, and Rare Cancers Australia are a partner in our broadcast today. Amanda's Head of Policy and Public Affairs. Amanda, what is Rare Cancers Australia? What is the National Oncology Alliance? And what is this all-important report you recently released, Vision 2030? How does it link to what we're on about today? Welcome.
Yeah. Hi, Julie, and thank you. Look, it's a pleasure to be launching this video series with you in partnership. It's very encouraging to hear what everyone has had to say about how important the patient experience is, particularly around even sort of subtle nuances such as, visual aesthetics and how that can impact patient wellbeing and anxiety levels. Look, at Rare Cancers Australia was established 8 years ago by Richard and Kate Vines. Kate is a 30-year survivor of thyroid medullary cancer, and to this day there are no subsidised therapies available for this type of cancer. At Rare Cancers Australia, we advocate for patients with rare and less common cancers and help them to find the voice. Also, particularly, we offer patient support so that patients can have the right treatment at the right time when they need them. And one of the sayings that Richard says quite often is that treatment delayed is treatment denied for patients, and often they can't afford to wait. And this for treatment because it means that obviously there's, very little hope for future. So in saying that, we've really grown as an organisation and also in our areas of advocacy, and we embarked on a project through what's called the National Oncology Alliance. Now, the National Oncology Alliance was established by Rare Cancers or founded by Rare Cancers, and it is slightly broader than the Rare Cancers Initiative in that it considers all cancers, common cancers as well. And it's really an advocacy arm that seeks to ensure that there's equity of access to the best emerging technologies and therapies for all Australians with cancers into the future. And obviously a huge part of this is radiation therapy and the area of radiation oncology, which from what we heard through numerous workshops that we conducted over the last year is that it's underutilised in Australia. And this is a real a real disappointing factor for patients. Because as we've heard, radiation oncology has so much, or radiation therapy has so much to offer in terms of potentially better outcomes for patients. It's also relatively safe compared to other treatments. But, from a government and funding perspective, we know that once all the logistics are established, that it's actually cheaper and cost effective. So it's quite often overlooked. And part of that is because I think there's a general consensus that it's it's an older type of treatment. And what we've heard today through the delivery of proton beam therapy through the Australian Bragg Centre is that there are substantial advances in this technology in delivering precision therapy that promises better outcomes for patients.
And Amanda, I'm so sorry, I'm going to have to come in, but I'll also, first of all, just thank Amanda Ruth from Rare Cancers Australia and the National Oncology Alliance, and we will put links through all our social media and our YouTube. And I also just want to emphasise, as we said at the beginning, that there's also very significant and ongoing advances with what is sometimes referred to as conventional radiation therapy, the sort that I had. And for many patients, conventional radiation therapy, which is more targeted and sophisticated and new developments all the time, will for many years be the treatment of choice. And then for some, it'll be proton therapy. Sorry, I had to bang in there, Amanda. It's the nature of the beast. But
can I just say before I get cut off, if you'd like to learn more about the report and the work we do, please go to our website at www.rarecancers.org.au and feel free to contact any of me or the contacts on the webpage. Thanks a lot, Julie.
Thank you so much.